Today we will be discussing UPSC CME paper. So this is paper 2 and booklet is A type. Uh, so we'll be discussing daily 40 questions. Start with paper 2. Mostly UPSC will test only one-liners, mostly one-liners and some good clinical questions. Uh, if you are preparing for NEET PG, it will be very easy to crack UPSC CME, and this is the paper which I cracked. So it's mostly one-liners. See the ratio of type 1 to type 3 collagen during the maturation of collagen in remodeling phase. Just one liner, just you need to know this is 1:4. And this question, which of the following statements regarding gas gangrene infection is correct? Uh, so, so first, gas gangrene is not caused by Clostridium tetani. Two options gone. Then, uh, Clostridium perfringens is not gram negative; it is gram positive. So this option is also gone. That's it. So answer is 2. Next, the term Gomphertarian curve. Just you need to know this is the sigmoid shaped curve. So this is related to tumor cancer cell. A 5-year-old male a 5-year-old male child comes to the left side. Scrotal swelling, which has no cuff impulse, does not reduce on compression or on lying down, but parents give a definite history of swelling is absent in the morning but comes by the evening. So the best treatment is so herniaotomy. In child we do herniaotomy, in adults we do hernioplasty. And coming to the fifth question. So 25-year-old man complains of dragging pain in the scrotum. The examination reveals scrotum full of bag of worms. So this is a buzzword, bag of worms. Bag of worm is varicocele. So the first step will be embolization of gonadal veins. Next, if a malnourished 60-year-old male underwent emergency surgery for strangulated sigmoid volvulus. After resection of sigmoid colon, a colostomy was fashioned. Post-operative period was trauma and he developed painful calf swelling in right lower limb. Most probable diagnosis is so after surgery, matlab there is no movement, immobilized patient. So pain in calf represents DVT. It is DVT. Consider the following in respect to salmon pets. See, these type of questions are very easy. You just need to rule in one option. Oh, basically you just need to rule out one option. That's it. So salmon pets, it is a hemangioma. Yes. Most common site is nape of neck. Yes, common. It is present in childhood. Yes, this is also common. But it does not need any surgical excision. So basically, you just need to rule out one option. And next, coming to the 8th question, clip ultrasound is in. I hate this. मैं हमेशा ये भूल जाती हूँ. This is my छोटी copy. There is no lipoma. Just remember. I hate this question. Uh, so, sorry. Um, Mickey Mouse sign in B mode ultrasound is seen in. So there are two Mickey Mouse signs. One is in common CBD hepatic artery there. One is in hepatic system and one is here common femoral vein and great saphenous vein and common femoral artery. Just remember two places where you see Mickey Mouse sign. It was not in the option that hepatic duct one, so go for this. And next, thyroglossal duct. What are the statements correct following regarding thyroglossal duct? Yes, it is a midline swelling. It moves up with swallowing, but not no. It moves with the tongue protrusion. This is a difference, no, with thyroid swellings and thyroglossal duct. These move with tongue protrusion. Yes, we operate to tongue position. So answer. You just need to rule one option out. Next, 11th one. A 60-year-old tobacco chewer and heavy BD smoker. So they said the oral white buccal mucosa with red velvety base plaque is leukoplakia. Don't mark erythroplakia. White velvety will background will be red. So it is leukoplakia and it is most pre-malignant. Cholestadapsis is seen with TB. This is just one liner. The best cosmetic results following breast reconstruction is lattice dorsi. Transverse recti, this is most commonly used, but best, they ask best, no? So best is latissimus dorsi. So again, trichobazar, that diagram, the stomach one. So hair in ball, correct. Psychiatric, correct. It leads to obstruction. It will be filled, no, like this hair. So it can lead to obstruction, perforation. We don't treat it with PPI. Yes, we treat surgically and remove that. That's it. We don't treat it with PPIs. And anatomic, one more irritating question. The inferior rectal artery is a branch of internal pudendal artery. This. Zollinger-Ellison syndrome is characterized by which of the following? This question actually, it, uh, it arises from beta. It is not non-beta islet cells of pancreas. I just ruled this is out. I ruled out this option. I think this is the answer. Meckel's, coming to the Meckel's diverticulum. It represents the persistent of remnant of intestinal duct. Yes, this is correct. It's not pseudo, no, it's true diverticulum of GIT. Yes, it arises from anteromesenteric border. Yes, it is heterotrophic mucosa, and most common is gastric, then pancreatic, no? This colon cancer, true about colon cancers. This right one, this is colon, this is colon. This is right, this is left, no? Right one will present with bleeding, not left one. The first statement itself is wrong. So even if this you don't see, right one presents with iron deficiency anemia. If they bleed, only then they can lead to iron deficiency anemia, no? And left side presents with obstruction. This is with obstruction and this is with bleeding. Anyway, option 1 is wrong. And right side are more common compared to left side. Coming to question 19. While managing esophageal perforations, which of the following favor non-operative management? See, here I know only two options are correct, so I'm guessing this question. Perforation by flexible endoscopy, this one is correct. And perforation in the abdominal esophagus, just only 4 or 5 centimeters is in the abdominal part of esophagus. So these both are right. So septic load is small septic load or big septic load? Sepsis is sepsis. By that I ruled out option 3. So I guess answer is B. Coming to familial adenomatosis polyposis. Yes, it is associated with APC gene on short arm of chromosome. That is correct. Autosomal recessive. Yes, that's also correct. Not 100% developed. carcinoma, colorectal carcinoma, only 70% develop colorectal carcinoma. Uh, which of which of the following statements regarding inflammatory bowel diseases is correct? Uh, Fissures and fistulas are more common with Crohn's disease, no, not with ulcerative colitis. So both are gone. And ulcerative colitis is most common with rectum, not Crohn's. So by ruling of options, perineal diseases is most common with Crohn's. And SB tube is used in the management of varicosal bleed. This 2 pipe 1. 2 pipe 1. Sorry, 2 bulbs 1, not tubes. My bad. Most common benign tumor of the liver is hemangioma, not adenoma. Don't mark adenoma, it is hemangioma. Just one liners. And best position to palpate the minimal enlargement of spleen. See, supine with lower lobe extension. This is absolutely wrong. We don't do extended lower limb. We supine and flex lower limb. This is normally done. So that's wrong. And palpation of left subcostal area with right lateral decubitus position. This is absolutely wrong. Uh, I guess D would be better option for minimal enlargement of spleen. Palpation of left subcostal area with knee, like 4, this dog position wala. Because they asked minimal, I shifted from C to D. I don't know which is correct actually, this answer. A young 28-year-old male was operated for perforated duodenal ulcer peritonitis after they recovered well for 5 days. Then he developed a high fever with chills and symptoms of toxemia. He developed right tip pain and intractable hiccups. So intractable hiccups are our buzzwords, and shoulder tip pain. मतलब gas under perforation, like the gas under the diaphragm. The gas under the diaphragm is irritating, so it may be post-op peritonitis. It cannot be abscess. Because of hiccups, I marked it as peritonitis. Next, in seatbelt syndrome, most common bleeding is from mesentery, no? Uh, Again, one more, just cause of exudative ascites is congestive cardiac failure. E first, is we do chest cavity, two lungs. Sorry, we do both lungs, and we do heart. We do right hypochondrium, left hypochondrium, and we do suprapubic. No, so it involves fluid in abdominal cavity, thoracic cavity, and pericardium. To abdominal cavity, no, and only pelvis, no, only pleural, no. So all. A 47-year-old man comes to the surgery OPD with recurrent UTI. He gives history of urine being frothy and occasionally having bubbles. So the probable diagnosis is anaerobic infection. Uh, Seen in normal pressure hydrocephalus, this is a wobbly, no? So this is gait abnormality should be present, incontinence should be present. So I know only these two are correct. So 2, 3 should be correct. And only one option is there, that is A. Which of the following are the functions of larynx? Fixation of chest is not a function, I guess. All others are all paka functions of larynx. Next, pericardial tamponade. Uh, Muffled heart sounds, yes. Tachycardia, yes. They won't be collapsed when there will be dilated veins. Now we see JVP, elevated JVP in pericardial tamponade because blood coming accumulated, right, and distended, and JVP will be elevated. So option 4 is pakka wrong. So there is only one option. Masoka staging is for thymoma. Which of the following clinical features, which of the following everyone present patient with cauda equina syndrome? Cauda equina, so there won't be any rectal, only urinary will be. So option 4 is out, not this one, not this one. So only in lower extremities, not in lower extremities, it is paraplegia. So both, like upper and lower limb should be the answer. Only lower limbs will be conus. According to me, it should be B. Again, one more. Longest acting local anesthetic agent, bupivacaine. GC, GCS of 10 is classified as. So GCS mild is 13 to 15, then it is 9 to 12, and moderate, severe is 3 to 8. This is severe. One more, gas gangrene is by Clostridium perfringens. Which of the following most common complications associate? Which of the following most common complications associated with enteric nutrition in post-op patients? So there won't be any predisposed systemic sepsis. Which of the following are correct regarding blood substitutes? These are biomyometric, yes. Extensively used in war injuries, yes. This is common. This is correct. This is also correct. They are used by, yes. This is also correct. They are not hemoglobin based, basically. Ischemia perfusion syndrome is characterized by hypoxia and activation of inflammation. This is correct. Thank you. We'll see next 14 tomorrow.